back to FMR Therapy. This is take. Oh, whoa. We're having technical difficulties. This is take 972 of shoulder range of motion. So here's the deal. I'm going to show you a little movement to help with your shoulder range of motion. If you're tight, if you're stiff in the shoulders, and or you have pain, right? Pain here, pain there, especially pain when you're reaching forward or reaching up. There's a little pinchy pain and whatnot. This is lovingly borrowed from Dr. Andreo Spina's FRC's functional range conditioning. We're doing controlled articulation. So his whole thing is, sure, stretching is great, range of motion is improved with stretching, but activating and controlling in those ranges of motion even better. You're going to teach your muscles and your joints something instead of just like, sort of passively getting there from time to time. So for the shoulder, we're going to find a wall. That's step one. It can be hard to find a wall in your house. So you can also picture me in like a doorway, right? So if I were standing in a doorway, I would have opened the door and the door would be here behind me, right? Not next to me, but literally behind me. This would be the doorway here, standing in the doorway like we used to, old school earthquake drill status. So, so palm against the wall. I'm just going to find something that feels comfortable in terms of standing away from the wall. You'll see what that means in a minute. So palm against the wall, elbow straight, and I'm just going to do a circle with my arm on the wall. I'm focusing on keeping my elbow straight the whole time. And then I'm looking for two other things. I don't want to lean away. That's just cheating. And I don't want to rotate with my arm. That's also just cheating. So really, really think about keeping your body forward. And if you get to a point where like, I just can't, I have to either lean, bend my elbow, or rotate, you have a couple options. One of them is to step away a little bit. The farther away I am, the less true shoulder rotation is going to be required, right? The less stress on that rotation, the less need for it. The closer I am, the harder this is going to get, the more actual articular rotation I need in my shoulder. So that's kind of, an elevated level, is being able to be right next to the wall. My elbow never bends, I never rotate, and I never pull away. So start with where you got good form. Do 10 circles. Step in a little bit, see if you improved. Step in a little bit, see if you improved. Another great practice is really just slowing it down and finding a great stretch with an activation. So you find that spot that it just gets really stiff, right where you want to pull away or rotate or change shape. And then you're going to make sure that elbow stays straight, and you're going to start pulling your scapula toward your spine to actually lift your arm up off the wall. I'm going to turn around so you can see what I'm talking about with my shoulder blade there. So I come up, I get to a point where my body really kind of wants to sneak away from this. I'm going to stay right there, keep breathing, and I'm going to start pulling my shoulder blade toward my spine to pull my hand off the wall. Watch out for that elbow bending. See if you can kind of concentrate on keeping that elbow from bending, because it's, again, just another little cheat that your body's trying to do. You should feel a really good stretch right in the front of the shoulder. You should feel a stretch down the arm. So let's say that you actually are dealing with a little bit of an injury, maybe a little bit of tendonitis in the shoulder. And so when you come up into an overhead position, or you're over here, there's just a ton of discomfort, maybe some sharp pain, pinching, something like that. Let's not do the overhead one. You can always start by coming from behind, right? And you're coming low, stay low, and then pull your arm away. So again, palm on the wall. We're starting from behind. We're staying low. Again, we're not letting ourselves rotate. We're not bending that elbow. We're not leaning away. And then we find a nice, comfortable place to squeeze our shoulder blade toward our spine. That's going to help us pull that arm off of the wall. And we can stay in a range of motion that we're not compensating, we're not shifting and changing, but we're also not getting any pinchy pain. 2 to 5 minutes every time you're working on this. It's not about how many reps you get, it's about how much time you're really getting. Do both shoulders, regardless if one of them feels great and the other one feels miserable. And let's try to get after this, 3 to 4 times a week, something that you can tolerate that doesn't create any pain and whatnot. Shoulder range of motion, you guys. We'll see you next time. Thanks for sticking around.